Hey there, it's Dr. Matt, and I wanted to chime in one more time to share a few thoughts about Donald Winnicott and Heinz Kohut, these last two theorists. And by the way, congratulations everyone for wrapping up the quarter. I know it's probably been a challenging quarter in some ways, but based on the work that you've been doing, it's clear that miraculously perhaps everyone is finding a way to really make use of psychodynamic theory and apply it in very imaginative and very highly relevant ways. So I look forward to your case presentations this week, but I just wanted to give a shout out to the good efforts that the class has been demonstrating so far. So I thought maybe what I would do is just mention how I think about each of these theorists in my work as a psychodynamically oriented therapist and what has stuck in my own experience. With Winnicott, particularly, I think one of the key terms is actually the good enough mother or the good enough parent. And his suggestion is that a child needs to have a parent, and particularly a mother, that is responsive enough to allow for the appropriate developmental needs of the child to be met. The mother does not need to be perfect, does not need to be perfectly attuned, and there is an understanding that, in fact, nature allows for a certain degree of variability in the provision of care for young, and that's nice because we can make mistakes as parents and then as therapists who receive parental transferences, right? So we are often thought of in the role of parent to, at least from an analytic perspective, to the client who often feels herself to be in the role of child or in a childlike capacity, needing help, needing care, needing attention. All of those things engender childlike experiences, which in fact is suitable for a psychodynamic therapy because under those conditions it's possible to repair, transform, further develop those aspects of oneself that for one reason or another were not fully nurtured or allowed to thrive at an earlier stage of life. So the good enough mother is that aspect of the mother or the therapist that is essentially committed to the process of being present, attentive, responsive, attuned, warm, caring, and so on toward the client, and consistent. So one other concept that comes up along these lines is the container or the frame or the holding environment. So a parent actually needs to create a holding environment, a container or a framework within which normal development can occur. So what that means is concretely appropriate shelter, conditions of safety, emotional safety, and also physical safety that allow a child to feel fed and nurtured and cared for, nurtured with food and also nurtured with emotional warmth. That all in a way is part of the holding environment. So that holding environment also then gets internalized as an experience of oneself as safe in the world. So that's crucial, right? And out of that experience also is extended the idea of the capacity for play and creative process. So when the therapeutic holding environment or the container is firm enough, consistent enough, and reliable enough, it allows for the capacity for creativity and growth, and thus resilience and flexibility and other good qualities that come from that. So those are a couple of terms from Winnicott that come to mind. One other thought about Winnicott that comes to mind is that he had a game that he played with young children that for some reason seems like a beautiful illustration of the spirit of his work. And it was called a squiggle game. And this is a game you could still use with children, especially children who are having a hard time getting in touch with words for their feelings. So Winnicott would make a little squiggle on a piece of paper, and then he would ask the child to complete the squiggle in some way or add to it. And then Winnicott would add to that, and then the child would add to that, and it would become a kind of game. And then at the same time, something was developing unconsciously, including the child's associations to whatever the squiggles were about. So whether the child became anxious, or whether the child became delighted, or whether the child became angry, and so on, or what images the child would see in the squiggle, which became a kind of a Rorschach, you could say, allowed for the analytic process to go forward. So I think that's actually a nice illustration of Winnicott's work too. So briefly, to mention Kohut's work and how it's still relevant, and the question was specifically about narcissism. So what Kohut really emphasized was the value of one's interiority, one's own subjectivity. And he was fairly radical about that. And so for clients or patients for whom normal psychoanalysis at that time were not very effective, namely people with so-called narcissistic personality disorders, Kohut's strategy seemed to be more effective. So what would he do differently? It seemed that he would provide empathic regard to the client's subjectivity as he encountered it. So he would attune to the client's subjective life, and then, as best as possible, be empathic toward whatever he encountered. So let's say you have a typically narcissistically injured client who feels sensitive to being devalued, or can be prone to grandiosity, a kind of a full of it sense of oneself, or a sense of moral superiority, or having the others around that person devalued or feeling somehow inadequate. So that would be a typical narcissistic personality relationship configuration. And if you're seeing a client with whom you detect that dynamic, that's one of the things that you can begin to wonder about. So in that situation, what does one do? Well, first of all, rather than trying to quickly analyze or interpret the grandiosity as somehow an aberration or a problem, a self-psychological perspective would tend to validate the grandiosity or mirror the client's good qualities, or the specialness of the client. So the mirroring transference is that experience with the self-object. In this case, the self-object is like the parent or the stronger person in the relationship equation, the older person. Because I'm stepping away from the specific role of parent because it could also refer to an older sibling, and later it can refer to an intimate partner, a friend, a teacher, anyone with whom one feels a sense of dependency or reliance. That could be, that person becomes a self-object. So in a mirroring self-object transference, so when a client needs to be strongly mirrored and they're demanding that they need to be seen and they need to be validated and they need to be seen as special, that means they are mirror hungry. They want that part of themselves reflected. So initially that would be accommodated. And so you would notice how strong the person is, or what an important quality that is that they have. They want the therapist to know about, or how much it hurts that they can't they can't have their sense of value fully appreciated by others, something like that. And also, if a client tends to be easily hurt narcissistically, that too would be empathized with. Let's say there's a client who feels that the therapist is intentionally trying to aggravate the client. For example, I have a client who's very annoyed by things I have in my waiting room. And he feels that I put those things in the waiting room intentionally to make him miserable, and that I don't readjust my waiting room bothers him and leaves him feeling that I don't care about him in some way, or that I don't want to take his concerns seriously. So rather than just telling him to knock it off, and that he's obviously asking for something that's very unusual and slightly inappropriate, I would empathize with him about what a loss it may be for him, or how frustrating it must be for him that it's not possible for me to actually accommodate him in the way that he needs me to. And then, of course, we can also link that back to earlier deficits, earlier ways in which our reenactment, the transference, is reenacting an earlier deficit. So that's one example of a way to make use of Kohut's work in the present. And I haven't spoken about other transferences like the idealizing or twinship transference. But this is at least a little bit of a taste of how these two amazing theorists can be considered in a contemporary clinical context. So that's all for now.